The differential treatment in healthcare of convicts and ex-cons. Differential treatment is a form of discrimination that occurs when individuals are treated differently because of an aspect of who they are. Healthcare is an important part of life, and having readily accessible and reliable healthcare is important to one's health and well-being. Medical care falls under the guise of care work, which is described as the mental and physical labor done in service of another person's well-being, health, or protection. Medical care is an example of paid care work in order to service patients with aid or advice for their health. We will be taking a look at the difficulty and discrimination that faces convicts and ex-cons in their pursuit of healthcare and medical assistance. When in prison, inmates have extremely limited access to healthcare. An investigation into medical negligence in U.S. prisons discovered the state of Virginia has 40 doctors to care for 30,000 prisoners, with most of the work being done by 700 nurses with as little as 1 year of training. These nurses are also unable to make a diagnosis or prescribe medication, only being allowed to perform CPR and basic care. In 2013, a nonviolent offender from Virginia Beach was unable to bring medication into a correctional center for diabetes and died during his 10-day sentence due to his lack of access to proper medical treatment from a state-employed for-profit company. Over the course of 3 years at Flavana Correctional Center, there are 10 deaths that Abigail Turner, an attorney with the Legal Justice Aid Center, believes could have been prevented if medical care from the for-profit company was adequate. Medical services that prisons employ are almost exclusively for-profit organizations that charge a copay, even if the inmate has recovered before they are seen. The copay is typically $5, while inmates are earning around $1.25 per day and must go into debt if unable to pay. The negative credential, which is something that qualifies you for discrimination or exclusion, of a criminal record is a factor of differential treatment and the difficulty of obtaining medical care. Due to the stigma surrounding criminals and the fact that people on the outside don't see the treatment of prisoners, there are very few unincarcerated people that will help inmates receive adequate health care. Once out of prison, ex-convicts are subjected to differential treatment and inadequate systems for dealing with newly released prisoners looking for medical care. A 2014 health and justice study conducted by professors from Yale, University of Colorado, University of California, San Francisco, and the University of Washington looked at the discrimination based on criminal record among recently released male prisoners. Of the 172 volunteers, 42% reported a history of criminal record discrimination by healthcare workers. This study also looked at intersectionality, which is how the differential situatedness of social agents influences the way they are affected and affect various social, economic, and political projects. When studying the role that intersectionality plays in differential treatment, they found that white volunteers were actually reporting a higher percentage of discrimination, around 60%, compared to 41% of minority participants. The theory given was that it was possibly the first time the white male volunteers had a negative stigma associated with them, or that minority volunteers were accustomed to the behavior and so reported differential treatment less often. Emily Wang's article for CNN highlights the issue that she, as a medical professional, has with the treatment of ex-convicts in healthcare. She took part in the health and justice study previously discussed and wrote that the mention of an incarcerated history led doctors to not want to prescribe any pain medication, even without knowing the nature of the criminal history. For almost 13 million patients that return home from jail each year, there are only 22 primary care residency programs that teach how to care for prisoners or ex-convicts. The differential treatment due to the negative credential of a criminal record is destructive not only to the patients, but also to the already stressed healthcare system. Wang states that the experience of differential treatment deters patients from seeking primary care and electing to wait until they end up in the emergency room, which is far more expensive for the patients, more resource consuming for the hospital, and may end up being too late for the patient.